From Acres USA, you are listening to the Acres USA podcast, a conversational podcast where we'll explore sustainable farming, regenerative practices, and the latest innovations in eco-agriculture with some of your favorite farmers and ranchers. I'm your host, Taylor Henry, the owner and CEO of Acres USA. Welcome to the Acres USA podcast.
It is kind of weird because since my last official live conference was January 2020, and then of course the world as we know it changed, and then I was able to sneak out for a heartbeat in October 2020 for a very intimate gathering to actually talk about mistletoe. And then this is my otherwise big gathering in real life with all of you, so I'm really grateful to be sharing physical space, not just virtual space with each and every one of you. I also want to let you know that I'm going to be using my notes today because I have so much I want to convey. And you know, if you've heard me, I go down a lot of rabbit holes and I want to keep myself on track with this. So I want to focus with this piece, and I do want to invite all of you to come to the Q&A because there can be so many topics we can riff on. So please join me over there later this afternoon. So that being said, what is near and dear to me is this very topic. And you've heard me say this at various conferences with each of you over the last, this is my 5th Acres talk, is amazing, is that you get me and my brain and the way I think better than any of my medical colleagues. And I say that every year, and I don't know if any of you recognize how big of a deal that is or how emotional that makes me to realize that we are changing healthcare, and it starts with all of you here. So, the terrain, many of you have heard me say, is what tells the story. We have quite a story here to tell. 1971 is a really good place to start. It was a big year. This is where we really made some major shifts from creating more grain production post-World War II in order just to keep up with the demand on more bread and feed for animals, thanks to an increase in concentrated animal feeding operations and moving more towards raising of beef and pork. That was a real pivotal time after the wars. Also in 1971, you have that end of the spectrum, but you also have good old Alice Waters, the champion of local sustainable agriculture, opening Chez Panisse in Northern California. So 50 years of a farm-to-table movement started back in that same year. It was also the same year that the war on cancer was waged. Haven't really pushed that one too far. It's also at a time when glyphosate had been discovered and created and used within a laboratory environment, and it was just a few years out from being kind of poured onto the land, and way different than it is today. This is also the year that cigarette ads were finally banned from television. It's also the year that the Berkeley chemists announced the first growth hormones later to be placed into our food supply. Big changes. It was also the first time we used a CT imaging scan to look inside our bodies. It was used in London at that time, long before we understood that having 4 CT scans in your lifetime is more radiation exposure than what you would have gotten with Hiroshima or Nagasaki. It was also the year the Nobel Prize in Medicine went to Earl Wilbur Sutherland for discovering the mechanism of action of hormones, especially epinephrine. And this was the beginning of our deep understanding of the impact of stress response on our body. It's also the year that Acres was born. Happy birthday, Acres. And it was also the year that I was born. So 50 is a pretty big year and a pretty big number for me. So when we look at the story of the terrain, you can see in a short period of time, in 50 years, I just highlighted a few of how much has changed in such a tiny amount of time that has forever changed the trajectory of our health, of our education system, of our agricultural system, of our food raising system. And so many of you have heard me speak over the years, but I wanted to give a little high bird's eye view of what we have talked about together in case some of you are new to this conversation and want to get curious and dive deeper on some of these topics. In 2017, that was my first time being with all of you. I will tell the story that I showed up thinking I was going to be speaking to about 30 or 40 people. And when they ended up in the room and they were opening walls and bringing in more chairs, I think that the guy told me that it was going to be 750 people expected for that talk. I almost threw up and passed out at that moment because many of you also know I have incredible stage fright. So it's always really difficult when I first get up in front of you because I have to really imagine all of you naked to be able to stand here comfortably. But you've always been so kind and gracious with my jitters, so thank you for that. But in 2017, this is where I discussed where we've all come from, okay, specific to the food system, where we currently are at that time, and where we needed to go with regards to the way we eat and how we produce the foods that we eat. We also at that time talked about everything from soil quality to the loss of nutrients to the monocropping of our world, creating monocropping within each of us. Which then leads, of course, when you diminish the microbiome in the soil and in yourself, that leads to a loss of resilience. And the chemicalization we talked about of our farming and animal raising methods, the impact on the environment, the concentrated operations for food production, carbon dioxide increases in our soil, causing higher carb content in our food, which is creating higher carb content in our bodies. That was a big talk, if any of you were there and remembered. And I can also remember your faces as it looked like you were drinking water out of a fire hydrant from me. So I took note of that. And in 2018, I came back and we discussed circadian rhythm biology. Remember how crammed and tiny that dark room was, and there were people spilling out and laying on top of each other on the floor? I was actually quite intrigued to see so many people interested in circadian rhythm, because I always thought that the farmers got circadian rhythm better than anybody. Got to get up with the sun, you got to go down with the sun. Got to follow the seasons. But our changes over these last 50 years have even changed that. A lot of our farmers do not know what time the sun rises and what time the sun sets, or when is the proper time of planting seasonally. So at that time we talked about our innate endocannabinoid system, we talked about our endorphin system, we talked about the light and dark sensing abilities within our cells, we talked about the loss of time in nature and an increased time in front of screens, and the importance of metabolic flexibility on how that impacts our longevity. So again, another pretty juicy year to review. In 2019, we took a deeper dive into food as medicine. And that's where we took a little more critical history, exploration of nutrition history. And hopefully you realize we didn't have much. And that most of our nutrition science today is industry-driven rather than health or reality-driven. And so a diet that actually promotes health and vitality and longevity is actually not what we're being taught in our medical schools. In fact, if you're a doctor, if you're a medical doctor or you're a nurse, you have less than 25% of medical schools even offer a single course in nutrition. And that nutrition course is elective for most situations, and it's incredibly watered down and industry driven. And so it's towing a particular industry line. So we kind of unpacked some of that mythology around nutrition at the time. And then in 2020, we went virtual. And that was a time when I got to speak to the concept of the soil to the soul. And this is where we went into discussions on the history of humans and their impact on the environment, and more specifically on their impact of the soil. And the fact that 95% of our food comes from the soil. Again, I'm preaching to the choir here, but it's incredible how many of my colleagues, how many of my patients have no idea that those 3 inches under their feet are why we can all survive here today. We also touched upon the destruction of the soil for longevity and how it impacts our own longevity. And in the United States, if you recall, we are the only country in the world that's actually losing longevity, whereas the rest of the world is either maintained or improving upon it. And we talked about that soil to soul concept, and that part of what's lost is that soul concept. We are dying today faster than ever because of pain and disconnect. And specifically, what has lowered our longevity is the rate of suicide and the rate of opiate overdose. that should be an indicator of where we are amiss in our soil-to-soul relationships. At that time, I also touched on the hygiene hypothesis, nature deficit disorder, loss of community, and the emerging field of green care therapy, basically go outside. The solution being my version of the CDC, if you guys recall, instead of the Center of Disease Control. This is our community, our diet, and our circadian rhythm, and how they all interact with one another. The hospital of the future will do much more than lip service, and much more than a few plants in a room, or much more than just looking out upon a fabricated landscape that's been highly chemicalized for your visual enjoyment, and moving us truly from a farming as food commodity to a nourishment, a requirement for nourishment. So we have been covering a lot of really juicy deep dive topics. So what I wanted to spend time talking about today is, what do we do with all this information? What do we actually do with this information? And so just to reiterate, these things are delicious and divine, but done too much, too often, it leads us to a lot of the things we've talked about over the last 4 years together, being more overfed and undernourished than ever before. And as I said during our last year together, I said that there's nothing healthy about our current health system. Nothing. It's a model based on disease management with no interest in prevention or disease or creation of health and wellness. Very big disparities there. And while you're looking at this image, it might help you to understand why the United States is ranked 27th worldwide in terms of healthcare. And yet we have the most expensive healthcare system in the world and are also the only country losing longevity, as I mentioned. The US spends over 20% of their gross domestic product on healthcare, when just 50 years ago, in 1971, that figure was 7%. Average cost of a meal at the hospital today is $1.37. How can you possibly nourish someone with that budget? Cardboard and distilled water would frankly be a better option for most of those patients. The most vulnerable populations that we feed this garbage to are geriatric, pediatric, and the infirmed. It's no wonder that we continue to suffer more and more thanks to these financial cutting of corners. So when you look at things like the other why, we have food deserts all over this planet. We have disparities between the rich and the poor. Not everyone can walk into a Whole Foods. We call it whole paycheck for a reason. And yet when you actually compare the price of eating healthy and eating processed garbage, there's not much of a difference. But there's definitely a difference in the way we market these things and the way we plant these factories of food, frankenfoods all over the planet that have people thinking that this is the cheaper and easier and more accessible way to go. And you guys are part of changing that dynamic for sure. And when we think about the fact that 80 to 90% of our healthcare, our health outcomes, depend on our external environment, it takes note from that external environment. This wellness ecosystem of ours is greatly tainted. It's greatly broken. Breaking free from this disease-managed model we call healthcare in the United States is not a small undertaking. It's increasingly difficult to effectively change or heal the current model. I know, because I've tried for 20 years to change it from inside, and I've unfortunately come to the conclusion that instead of trying to fix what's broken, we have to start completely from scratch, literally from the soil up. The time is now to build that model, leaving the three big players on the sidelines instead of on the field. And that's going to be big pharma, big ag, and insurance. The only way you change this system is to extricate yourself from those big systems. The other night I had a group of doctors that I train and have the privilege of learning from. It's a mastermind, it's a network. We lean on to each other to inspire and educate and empower each other in how we can collectively change this system. And because I was here arriving at Acres, I stumbled across a quote that I shared with this group. I feel like it's also very appropriate to share with this group. And you will start to recognize why this system that we're talking about, this new system we're talking about today, is so dependent on each and every one of you to make it succeed. So Satish Kumar is a British Indian philosopher and activist, and he says this: holistic thinking brings soil, soul, and society together as three aspects of one big picture. This is the new Trinity of our time. When we become single issue oriented, if we believe that the only way the world can achieve health is through environmental sustainability, or if we believe that only everyone should practice something spiritually, or if we believe that only establishing social justice in the world will answer all of our woes, that everything could be sorted with any of those individual systems. But this very single issue obsession doesn't take us very far because it's frankly too narrow. All issues are interrelated. The trinity of soil, soul, and society encapsulates the big picture. So letting that sort of sink in, to realize that we all have something to offer in changing this system, and we all need to lean on each other. I've seen it myself. There's a lot of, you'll see me giving some stats here in a moment, of there is a wellness wellness movement, but it still very much separates the system. You'll see examples of that in a moment. Wouldn't it be amazing if all of us equally had access to clean air and water, to really knowing the rhythms of the nature around you, to knowing what time your sun does rise and set, to have unlimited access to nature in environments that are inviting and safe and welcoming and clean and pristine, to actually be able to take time to rest and digest, to actually engage in a new CDC, a true Center of Disease Control out here. Quite a different concept here. And so before we start to talk about some of the solutions, it's very important to start with yourself, to take inventory for yourself, for your families, for your communities, for your states, for your countries. Year after year, I ask this question, and I'm going to do it again today. How many of you here in this room right now think that you're healthy? Okay. Now I'm seeing a few faces that I've seen raise your hand, because I think you guys have been working on this. I think you have been probably seeing this. But I also like to ask the question, how do you know? Because for me, growing up living in a very pristine environment in the mountains of Colorado, on the outside, that place looks ideal. People flock from all over the world to Durango, Colorado to enjoy the beauty, the natural beauty of my landscape. And yet it's probably shocking for you to know that it is one of the most toxic waste dumps on the planet. It has the highest levels of arsenic in the country. If you look at a map above the Four Corners region of the United States from satellite, we have the largest methane cloud, and no one understands what it is. We have the highest levels of mercury thanks to all the coal burning plants in the Four Corners region. We have 27 possible carcinogens in our water source and 7 known in our water. We're still one of only a handful of counties in the whole state of Colorado that still dumps fluoride into our water system. So this beautiful, affluent, outdoorsy, health-conscious environment are some of the sickest patients I've ever had to support. And so I want people to start to take their own inventories. I want you to put your zip codes into the environmental working group and take a look at what's in your water. I want you to put your zip codes into the EPA Superfund site and take a look at how close you are living to a Superfund site, either one that's already been in process of remediating or one that needs to be remediated. I want you to put your zip code into air quality apps and air quality platforms, just to know what you're being exposed to on a day-to-day basis. And that will definitely enlighten you. Maybe you saying that you're healthy now may change your understanding of what health is. It's not just the lack of symptoms. It's much, much greater than that. In fact, Webster's dictionary says health is the condition of being sound in mind, body, and spirit. It's also defined as the general condition of the body. And it's also defined as a flourishing condition, one of well-being. And so when I really sit down with patients today, especially patients coming to me with the diagnosis of cancer, they say things all the time, and I know I've told this group this. They say, well, I was healthy until I got cancer. Those realities cannot survive on the same plane. It's incredibly impossible. There's no way a human being gets cancer or expresses cancer if they're healthy. It's not at all possible. And so we want you to be taking on, and that's true for cardiovascular disease, diabetes, obesity. They're all the same disease. They just express differently. They're all little subtle and maybe not so subtle hits to our mitochondria that over time accumulate and then create vulnerability in our DNA and then cause a whole cascade of disease events. Put simply, our terrain is sick, and we have to go to great lengths to explore what we're putting into our own soil to know how to best remediate it. So we have taken a few steps along the way. You know, how many of you have ever heard of or seen the movie The Road to Wellsville? Kind of a quirky Anthony Hopkins, I'm pretty sure, quirky movie. There was a huge movement in the late 1800s, early 1900s on these wellness retreats that people would go up to the Catskills, or they'd go out to places and take the waters and sunbathe. They were nature cure clinics. They were known as sanitariums. That was something that was very inspirational at the time, and this is before the Flexner Report came out in 1909, which changed the way we think medically and about health within a decade of these wellness communities being sprouted up all over the country and all over the world. And so in 1909, the Flexner Report came out and basically said the vast majority of the educational systems here, which were at that time osteopathic schools and naturopathic medical schools and homeopathy, were shut down. And what we know today of the American Medical Association and what we know today of the allopathic medical field, it's in its infancy. It pushed everything out. It threw the baby out with the bathwater instead of integrating and improving upon foundational vitality medicines that have worked for thousands of years. It's just incredible to me. And then we started into, the policy making. That's where the AMA and the FDA and all those pieces started coming together. So we started creating planned communities, like neighborhoods. Very different. We were definitely more communal and more. We weren't as urban as we are today. And we mentioned Alice Waters and the food movements that started in the 1970s. In fact, I guess that there's probably a handful of folks here that have been part of those movements for the past 50 years as well. And then we've moved all the way up that where we reached the 2000s, we started reaching to some technologies that helped us start to know each other exists. The gift and the curse of this, right? We don't want all that screen time, but we certainly appreciate the ability to connect now in a way that was never there before. And where we are currently, we're now starting to see health as a commodity. There are very wise business people out there realizing they can make a buck in selling the idea of health. It shouldn't be a commodity. It should be innate and available to each of us. In the attempts to sort of impart change on this system into something new, we have been taking steps, as I said. A paradigm shift for some time, as I mentioned, that there's just this evidence of this wellness commodity and movement away from health as a universal right. But there's also an important balance between those two corners. I live in a part of the country now, or a part of the world now, in the winters. I live down in Mexico. And the majority of the expats that are down there in the winter months have a medical system that is free for them. And we in America, we're like, oh, that's so exciting. Until I sit around, and when COVID hit, the reality was glaringly obvious of how much a system like that is failing humanity. When everyone is so absolutely not willing to pay for health, not willing to pay for better food, not willing to take any prevention or pay anything out of pocket, and to take zero responsibility, as well as have a sense of entitlement that the amount of cigarettes and beer they can possibly consume in a day is not going to have an impact on their health care. It was terrifying to watch the mass hysteria that took over this community I lived in when COVID hit. It was incredible, and it showed me the flaws of even a socialized medical system right in my face, where I had sort of been jealous of them for many, many years. And that's when I realized we have to have a balance between sort of the commodity of health, the universal right to health, but also where are we teaching about the personal accountability and the personal responsibility. Health is not guaranteed to any of us. It is created. And it takes a heck of a lot more now to create it on this planet that we live on. So just some things to kind of linger on while you're thinking about this is a couple like things that we're seeing out in the world of the commodity side of things. We're seeing a rising interest in wellness certifications for residential projects. We're seeing multifamily wellness becoming ubiquitous in luxury properties. We're seeing expansion of urban and suburban middle class demands, asking for more wellness features in master planned communities. We're seeing more wellness living concepts targeting seniors and young adults in kind of like mixed generational living systems. We're seeing retreat-style wellness expanding to every major destination, spa, and resort across the globe. We're seeing greater emphasis on natural areas, outdoor recreation, and public spaces, and access to these things. We're seeing a post-COVID emphasis on indoor air quality and general sanitization, especially in workspaces, school, and retail. Come back to that one in a moment. We're also seeing post-COVID reconfiguring of workplaces with health protecting and health promoting features. I want you to also hold that word health protecting, health promoting in your head. And we're seeing investors who are driven by that tenant demand, and governments driven by the health costs helping propel this growth altogether. And we're seeing increasing overlap between planetary health, the sustainability, and human health, the wellness, even down to how we build our buildings. One theme that you probably notice here is this is still something that's for the affluent. Okay, we're not really talking about what you do for the disenfranchised communities. And then things like wellness real estate. There are some positives that come out of this, such as childhood health and asthmatic children in a community called the Breathe Easy Homes study in Seattle, Washington area showed that they could lower the cost of medical care and the need for intervention, along with dramatic improvement in kids' lung function simply by purifying the air. Like, that's a pretty big order. In Austin, Texas, there's communities that inspire movement. Walking, no car zones, pedestrian zones, more interaction with neighbors, stronger neighborhood cohesion, no driving into your garage to go into your house. You know, remember porches? Remember waving at your neighbor? Remember knowing your neighbor? Luckily in this group, I'm probably preaching to the choir. Most of you probably still do that, but you're weird compared to everybody else on the planet now. We're the weird outliers at this point. In communities scoring the highest for active living environments, such as walkability, bikeability, public transit, and parks, they also have the lowest incidence of smoking, obesity, diabetes, high blood pressure, hyperlipidemia, and depression. Significantly lower rates compared to environments that don't have access to that type of thing. In Mariposa, there's a project called the Mariposa Project in Denver, Colorado. I'm not sure if any of you know of this community. Within 3 years of launch of this project, and it's basically a project in the projects, okay? The crime rate went from 248 to 157 per 1,000 people, and 38% of the residents said their health improved, and smoking rates dropped 6%. That's pretty incredible in an environment that would have no access to these more fluffy wellness concepts. And then in Stockland, Australia, there's a community where 6 out of 10 feel healthier since moving to it. 68% are doing more exercise. 2/3 of the residents have made new friends. The average personal well-being score is 79%, well over the average of the rest of the country. The CDC, as we talked about, do you see that theme, is really instrumental. And projects like this are truly sparking up all over the world. I luckily sit on the board of many projects like this and take advice from others who are doing projects like this to help us envision this one. So again, many of these examples are mostly still available only to the haves and not to the have-nots, and we aim to change that as well. So the future of healthcare, what does that path look like? We left off talking last year about, wouldn't it be amazing if folks' insurance covered weekly CSAs? Wouldn't it be incredible to give incentives for the number of hours that you spend in nature? Wouldn't it be incredible to offer tax breaks to those growing a garden or volunteering at a community farm? Those aren't difficult things to weave into our system. And all of this vision of the future of healthcare started for me about 29 years ago. On October 21st, I celebrated 30 years out from a terminal diagnosis. When I was given no way and no possibility of survival, I had to find a way myself. I'm still finding that way 30 years later. And that 30-year journey cost me hundreds of thousands of dollars in education and continuing education and traveling all over the world to find out who's doing this right. And there are a lot of people doing parts of it right, but I have yet to find anyone doing all of it right. And so I feel that that diagnosis was my wake-up call, was my calling and my passion and purpose to do this right. And so with that, this vision, literally, about a year and a half into my terminal diagnosis, which I'd already outpaced their expectation of my expiratory date by a good 9 months at that time, or beyond actually, I woke up to a dream that was so specific, so real. I knew exactly what the land looked like. I knew exactly, I had the feel of it. I could smell it. Have any of you had that experience that you know? It is like, this isn't a dream. This is a vision. As crazy as that might sound to some, I couldn't shake it. I started madly writing everything down, what it looked like, what the details were. I started writing lists upon lists. My husband thought at that time, boyfriend, thought I'd lost my ever-loving mind, but it was a woman dying of cancer, so he didn't have much bandwidth for what was happening there. But this institution, this institute, this vision has taken form over 29 years. This is a nonprofit residential hospital and research institute with special focus in oncology care and prevention along with wellness. The Metabolic Terrain Institute of Health, MTI of H, is changing the standard to cancer care and prevention from the soil to the soul and recasting cancer from a death sentence to a manageable disease process. No small undertaking. So why the desert? When people find out that this institute will happen in southeast Arizona, why the desert? I don't know why, that's what the vision told me. But for some reason, for me, the desert conjures up ideas of dry, prickly, hot conditions that to the non-observant eye can look inhospitable to life. And yet it hides so much potential that with the tiniest nourishment or a tiny drop of water, it springs back to life. This environment encourages thriving in adversity. Arizona also happens to be a state that has a very wide scope of medical practice. As a medical doctor, you can practice homeopathy. As a naturopathic doctor, I can cut out your lipoma and give you a prescription, deliver your babies, and everything in between. It's a very communal medical system in that environment. It's also an area that's in a region of year-round growing potential, being in high mountain desert, far more than a lot of the other places I'd been eyeballing. It's also an ease of travel for patients to and from around the world. Even though Colorado is near and dear to my heart and home, it's not an easy place for people to travel to for their health. That elevation is very challenging in many of our patient populations. In fact, dangerously so. So we needed to find something that was a little more, allowed them to oxygenate a little bit better. And it's also in an opportunity zone, which means that it's an area that entices investors because it's an area that supports diversity in economy, diversity in people and culture, and provides lifestyle amenities that embrace, create, and support health. And it's also near several academic institutions where we can lean into each other for support with actually showing the data that this is a better way than what we've been currently dealing with. So these are some of the campus components, okay? We talked about that quote earlier from Satish Kumar about none of these, if we all just focused on any one of these, like many here maybe just focus on food systems. I go to conferences where they focus just on green energy. I go to conferences where they just focused on personal well-being. But together, there's something really profound that happens here. And so this is how we will be embracing the trinity of our time of the soul, the soil, and the society. And here is where you'll have a convergence of talented, passionate teammates and technology that have their own wake-up call in the world to better take care of ourselves and our planet. It's also a campus where systemizing the methodology to enhance patient outcomes and overcome the physician burnout rates by automating a very comprehensive patient assessment, the motto of test, assess, address, don't guess, where individual therapy is placed in the right order and the right time and the right dose and the right direction will actually lower the guessing game, the side effects, the cost to do business of health, and scaling it in a way where training and equipping physicians and patient advocates around the world to apply this methodology to help teach wellness and help people implement those changes that are necessary to integrate these models in communities all over the world. Last year, I introduced this vision over the virtual gathering we had together about taking charge of being part of the solution or being the solution. It has since gone from a little bit of a name change to an addition of a new founder, but it has never deviated, not once, from the original purpose that was born 29 years ago. We have spent the last 2 years building the virtual campus and the concept, and now the land is within our reach to build this new healthcare system literally from the soil up. At this point, we have over 80 physicians with another group starting in February, along with 100 patient advocates with another group of patient advocates starting training in March, that are building this vast network that literally surrounds our globe right now. And we're all taking up the call to action to change this together. That, along with building out of the database to collect and manage all of this data, all this information, is going to help us show the reality of better outcomes with different approaches, which are paving the way for a whole different system. And so our current operations, I mentioned the training, I mentioned the platform, the data platform that's being built out, I mentioned the network, the team, the tribe that's making this come to fruition. But it's also a charitable environment. This is what helps us break down that barrier of the haves and the have-not. If you seek alternative healthcare or integrative healthcare today, if you seek to go outside of the lines of standard of care, if you seek to bring on something outside of managed medicine, managed healthcare, you have to pay out of pocket for that. And in most cases, you have to pay dearly. So I serve patients with cancer. That's what my work is now, and the physicians that work with them. The average person, if they step out of the box and go pay cash for integrative oncology, they're spending somewhere between $50,000 and $150,000 out of pocket. The irony is that is 10 times less than what it actually costs to do standard of care oncology. But you don't know that, just like in the subsidies world. Can you relate? People don't know the real cost of gasoline or milk or grains, just like they don't know the real cost of healthcare. And so helping people start to become aware of that drastically changes where they decide to invest their money, where they decide to invest their time and energy. And so with that being said, here's some of the trainings. So we train physicians on the application of mistletoe. I train physicians on integrative oncology, and we are now training patient advocates. So folks who've walked the journey, perhaps with their own family member, who would be a great service to helping other people walk this journey as well. Oops, this just froze. Oh wait, sorry. And so It's having a little delay. Here we go, let's try this again. So imagine going to a nonprofit hospital. By the way, nonprofit, this is interesting to me. 7 out of 10 of the most profitable hospitals in the United States are nonprofit hospitals. And you're like, wow, that's cool. When you think nonprofit, most people think, well, that means that they're not sort of raping and pillaging the community to financially, serve themselves. And yet when you look at the reality, yet again, of what a nonprofit hospital looks like, Cleveland Clinic is a really good example, okay? You look at the communities surrounding that hospital, and that should tell you everything you need to know about how well that hospital is serving their community. Have any of you gone to a high-end medical, academic university hospital institute? It's like you have to have bodyguards to drive to the hospital. That should not happen anywhere on this planet. And the head CEOs, the head directors of these nonprofits are profiting so much. We're talking the average income for a person running one of those hospitals is $3.4 million a year. That's the average. And yet for those 7 out of 10, their average is between $16 and $24 million a year. Now, I'm not here to diss anybody making a good living, but when you look at the concept of a nonprofit is to change the tax burden, okay? You don't have to pay federal taxes and you don't have to pay property taxes with the expectation that that money that you're not spending there goes back into your community. That's what it's supposed to be designed to do. So we're actually going to design that. Our goal is to take the profits that come in from this nonprofit environment and put them back into the community so that everybody thrives, not just on the campus, but off the campus as well. And so imagine going to a nonprofit hospital where you are immersed in nature while participating in the planting, the cultivation, and the preparation of the very food that nourishes you and the others on the campus and the surrounding community. When you are reconnected to both soil and soul, all while receiving state-of-the-art testing and treatment based on your biochemical blueprint, and returning again and again with your loved ones so you can be educated and empower and receive actionable solutions to chronic health challenges, putting patients in the fields with the farmers, the greenhouses, the orchards, and the pastures, as well as their caregivers and the hospital staff and the administration. We also plan to build all of this on a 300-acre property, which will in essence be an edible regenerative landscape. Many of you have heard of hospital to farm or farm to hospital movements, or farm to table movements. A hospital can claim that little PR blip for themselves if they have about 10% of their food offerings coming from a local farm. That's like lipstick on a pig, okay? I mean, it's great, it's notable, thank you for that. But can you imagine if all of the food being raised there was done together, that every single resource came from the land or the surrounding communities and leaning into each other? Can you imagine the change in consciousness? Can you imagine the change in health? Can you imagine the change of investment into time and energy of doing this? I don't know, it just gets me all giddy. And so this is our first renderings of the land that we're eyeballing. And in fact, by December 15th, we should hit our mark to actually be able to secure this land, which I can't believe I'm saying that out loud. It makes me actually, I know, some people are like clapping in the background because this is huge and I'm incredibly emotional just even thinking about it. But this part of the 300 acres is just the hospital itself. It's an inpatient, outpatient care where we do deep dives of testing, tissue assays, imaging. We do it all. It's a hospital, right? Conventional hospital. It's got guest rooms and family suites. It's got a welcoming, like everything. It's seamless between its movement of nature and the indoors to the outdoors. We have a teaching kitchen. We've got source local ingredients, whatever we can't grow on our land in the first couple of years. We've already been partnering with our farmers in the area and ranchers in the area. We have a wellness center as well. And those staying in the hospital will also enjoy the wellness center, and the wellness center will also see our folks that are going through treatment. Separating out our sick and our healthy from each other is also dangerous. Because when patients sit in the circle getting their IV chemo in hospitals around this country, and they work with one of my trained physicians, every single time the other patients or the nurses ask those patients, why are you different? Why do you look healthier than the rest of us? Why are you blazing through treatment so much more effectively? Why are you able to stay on target with your treatment times because your blood counts aren't crashing? Why are you not munching on the cookies that they're handing you while you're getting your chemo drip? Because these are patients that have been educated and empowered to do it differently and end up with better outcomes. And then later they become advocates to teach others. And then those people become advocates. It's like that STD chart from the 1980s of whoever you slept with, they slept with, and it all spreads on and on. This is like what we're trying to do, but in healthcare, in the positive direction. We're trying to be a positive viral sharing of the love versus another. And so when we look at the whole campus, this gives you a glimpse. The hospital is a tiny piece of this puzzle. You'll see that in the corner of this campus is literally the spiritual center, cultivating our spiritual self as well. That it is a farm, and the hospital itself is a crop on that farm. We have a convention center that can house 500 people. So maybe our next Acres conference is there. We have farm-to-table restaurants and farmers markets. We've already made relationships with our local food bank. Equine Therapy Center. We have a whole group of vets that are using equine therapy for PTSD. Well, who living on the planet today doesn't have some level of PTSD? We know the power of animals and connection to nature are very grounding and soothing to our emotional state. We have public parks. We've got timeshare. So we do still help those with means find a place that they can thrive on. But we are welcoming and opening, inviting, and actually can support people who don't have the means. How incredible for everyone to intermingle in the same place and share the same resources, to be on the same playing field with one another. And so currently in the phase, as of the end of this year, we should have a checkbox right next to that Arizona land acquisition. This land has been waiting for me for 10 years, by the way. 10 years. It has been under contract multiple times, and it always falls through because it's waiting for me. I know it. And even the people who own the land have been starting to say that in the last couple of years. I'm like, it'll be fine. We were supposed to buy it in June of 2020, but everything with COVID pivoted. And I'm so grateful because actually what we've been able to work on in the interim has even made this better and has distilled our vision even further. When you look at building a hospital today, the actual cost of most hospitals from ground up is between $250 and $350 million. And those are for very toxic building materials. That's for like huge, people are at bidding wars on bringing in entire resources. We're going a very different route. We're going deep green building biology, ground up, no EMFs, hardwired everything, remediating the soil while we're remediating ourselves. And we can do it for about $87 million. That blows people's mind because it's about the relationships we're building and have built over nearly 30 years. The people coming out of the woodwork saying, I want to help. I want to help be part of this. I want to be part of this legacy. I want to have my name on one of the walls of this institute to say that I was part of this change. So in 50 years, at the next Acres 50-year celebration, we'll be seeing these all over the world. This is just the beginning. And so when we look deeper into health and longevity, it's absolutely dependent on how we adapt in, out, and around our environments. The changes in the world around us have really pushed the need to take more thoughtful approaches to our healthcare than ever before. We can't just assume health. We can't just be promised health. We're not entitled to it. We have to work for it. And our diet and the means in which we grow our food is absolutely foundational. I mean, I know many of you probably have seen the studies where kids who don't get breakfast, they have behavioral problems, they have, they can't concentrate. Their immune systems aren't as strong. It's like, can you imagine nourishing the most precious commodity on this planet, which are our children, and their children, and their children? One of the things that'll be on this campus is an early childhood development center. We want to have a place where, when we know we're bringing in 1,200 jobs to this very socially economically depressed part of the state, if anybody knows Southeast Arizona, you know it's a no man's land, right? When we bring in 1,200 jobs, where do those families, where do their kids go for daycare? Where do they go to school? Well, they'll go to school there and daycare there, along with the doctor's kids and the other patients' kids, patients coming from all over to stay for a few weeks to have their own health addressed while their kids can play among this environment. When we have communities that support us as much as we support them. This is how it was always meant to be. We've never been able to be siloed. I use that pun very specifically with this group. We don't thrive in a silo. We thrive together. And there's ways to do it in a way that monetizes it for those who have that driver, but a way to make health and wealth happen simultaneously for all of us. There's no need to separate it out. So we can definitely rewire our biology to rewrite our biography. And also, in a conversation I was having yesterday, a lot of us, our biology is based on our biography. And so having an environment that helps you really understand your story, where you came from and where you need to go and what you can rewrite or recreate for yourself, is life-changing. Thanks to that experience and that awareness and that wake-up for myself 30 years ago, I was able to survive the unimaginable. And that unimaginable wasn't my cancer. That unimaginable was the trauma of addictions, the trauma of poverty, the trauma of abuse. That's what most of our world is being raised in today. And so the resilience to come through something like that, cancer's easy after something like that. But to recognize that my cancer came from something like that and to help others explore their process is where we want to keep building out the relationships that help us coexist and thrive. You can learn more about what I talk about from these last few conferences together in the metabolic approach to cancer. And I just got to hold for the very first time in my hands my own copy of the Mistletoe book that I just received here at Acres. Even though I'm one of 7 authors on this book, this was an amazing undertaking of physicians from all over the world, all different backgrounds, not just talking about mistletoe, but a lot of the concepts that I talked to today about what's working and not working in our medical system and where it needs to go. So it really is a nice commentary on this. And then ways to follow and ways to get involved. Already over the years, in fact, I'm looking out in this room and I see a handful of you who've literally stepped forward and brought your expertise into helping make this come alive, make this vision come alive. The piece that is, I got the health care part down perfectly, but I don't have how to absolutely nourish that land figured out yet. And so I need all of you for that. And with deep gratitude, I hope we continue this conversation. Thank you. So I actually finished up a few minutes early, which never happens. Thank you, notes. But we've got about 15 minutes before the book signing, so I'm just here to take whatever questions you have, on topic, off topic. Just don't ask me, the origins of belly button lint or something like that, but I'm happy to take any of your questions if you're willing. Okay. Sure, sir.
You talked about separating big pharma and different companies. Can you address the AMA? And how, just in the last few months, I've noticed that the AMA very punitive against their members.
Yes. Yeah.
I think it would be better if you could break through the AMA,
Yeah.
the partnership, because most people have doctors who are members of the
Yep.
AMA, and if they're still resistant,
Yeah.
it's going to be a difficult journey.
I'm really glad you brought that up. about just the resistance of how do we overcome sort of the ideologies or the structures that have been put in place by our very medical associations. And those are quite limiting. And so, frankly, more and more medical doctors are leaving the American Medical Association. More and more naturopathic doctors are leaving the Naturopathic American Association, and others because we are being confined in to an industry-driven model and not a common sense model and not a model of true regenerative health and prevention. And so when we talk about deconstructing the entire system to help this work, we're going to have to get out of those boxes. We actually have to disentangle from our very organizations that dictate how we practice and how we think. So that is one of the reasons this hospital, it's also a nonprofit, so it's nonprofit. So there's that piece, and we're not going to take our money from industry, which most people do in these big nonprofit organizations. They get money from insurance companies, they get money from big pharma, they get money from big ag. Okay, that's actually what funds a lot of the building of these big nonprofit hospitals. We're going a philanthropic endowment route instead. It's also a research institute. And what that means is our patients are aware that we are a place where research is being done. And people will be made aware of that, and they will sign, they'll have very good informed consent to understand that what we are doing may or may not be falling under the guise of the FDA approval system. And so people being aware of that gives them the personal accountability to make the choice for themselves. Now, luckily, we had a bill passed a couple years ago called the Right to Try Act. I don't know if any of you are familiar with that, but in the cancer world, this is probably one of the biggest blessings we've ever seen, which means when patients have quote unquote failed therapy, which is strange wording, okay, that's what they say. It's not what I say. I say when the treatments have failed the patient. Okay, but when the treatment has failed the patient, and there's nothing else to do, they're still often dictated by a medical environment, by insurance, et cetera, that, well, if it's not standard of care, we won't cover it. But this Right to Try Act has actually started covering therapies and interventions that are completely out of the sandbox and are allowing people to get therapies, much needed therapies that are otherwise cost prohibitive, to get them covered because there's frankly no other option. So that's been a huge gift for us. One of the other things that's happening is we're building an oncology wing, a pediatric oncology wing. And I was just visiting with someone before the talk today that if you are a parent whose child is really suffering under the standard of care approach and you opt to leave that approach or not engage in it at all, your children can actually be taken away from you. Okay, I have patients who literally go into hiding, take their families out of the country. Many of you know some high-profile cases that have made the news in the last year or so. And these patients are still living and thriving. And when they come back, the families are still being threatened to have their children taken away. This is going to be an environment where that doesn't happen. Okay, part of building this near the border of Mexico is even though we're a research institute, we have a big IRB and we can do all of this, we still know that any day someone could come in, shut off the power. But we will be able to shuttle patients across the border into a little sort of sister clinic that's there that will not break up the consistency of care for those patients. We hope we don't have to use that, but I had to think in those terms. We're also a cash-based model, and we're leaning into the shared medical system. So many of you in this room, and myself included, we're part of like insurance share programs. How many of you are familiar with those? Instead of like just straight up insurance, you've got these communal share programs where basically we help pay for each other's healthcare, right? And so the fee for my husband and I is $399 a month for both of us to get insurance with a $250 deductible through the share program. Whereas had we gone conventional, it would have been anywhere from $1,500 to $2,800 a month with a $15,000 deductible for a healthcare system we never would have used. The average American uses $20,000 a year in healthcare premiums. The average American. Can you imagine shuffling that money into a different system? Can you imagine how much wellness and prevention you can do for 20 grand a year? Incredible. I saw a hand come. Did you have a comment about that? The one that you use, pardon? Interesting, because wow. Yeah. Yeah. Wow. Yeah. And this is the broken system. Even in some of these share programs, there's still pre-existing sort of rules and conditions. And so one of the things we're doing behind the sign is creating a new share program model. Okay, that's very, very specific to an integrated model of health. So we're working very hard on that. We actually have, we're repurposing one that had been, it's kind of gone dormant, but still has its status to fit that category. So hang tight and follow me there. And then we're also in this group because of our organization. Now, thank you for that, by the way. And it was, Liberty is one that's really common. And so I'm really sad to hear that. I think that COVID has really kicked the snot out of a lot of these share programs because it's been very, very expensive for some of the things. So I think that their coffers have run a little bit dry. It was predated. Okay, it was there. Yeah. So hopefully we're building a new one. Okay. And then the share cost of even driving down laboratories, lab costs, driving down imaging costs. There are definitely examples of this. I was just talking to a colleague who, there are examples of communities who've created their own programs, their own packages, their own competitive pricing models. You have enough of a network to do that, enough of a community to do that, you can break out of the system pretty easily and pretty effectively. And so we're using some of those models in this. And then we also have research dollars that are coming in. People want to research our population. They want to understand why our outcomes are better and why they're different. And then we do have the interest of insurance saying, wow, if a person actually pays cash, this just happened with a patient who was able to get coverage for a very expensive procedure in Turkey, but it was so much cheaper than MD Anderson's offering that the insurance paid for his treatment, his 15 weeks of treatment in Turkey, including his airfare there and his stay, because it was that much cheaper than the experimental drug at MD Anderson. And he's in remission. So these are the types of stories that you will hear more and more of as we build this up out there, in that we have to start a totally different, we have to break completely out of the construct. And so that's the only way it's gonna work. Like I said, I tried for years to try and fix it within, and that did nothing but make me sick. And I frankly don't have that, that desire to go back to that place. And so it's incredible to see the resourcefulness out there of a bunch of like-minded people and how powerful we are. And it's powerful enough, just to give you an example, we had someone come to us about 2 years ago willing to pay the entire, they're like, here's 100 million, not 87 million, here's 100 million. And that put the hairs up on the back of my neck, did a little research, did a little dig. These people were scared. They wanted to buy our concept and bury it. That is when I knew we've made it. And so that's why we're also being very, very careful and thoughtful of our of where we're collecting our support from. So yeah, great questions. Thank you.
Thank you for listening to the Acres USA podcast, a podcast production of Acres USA. Find us on Spotify, Apple, Google Play, and other popular podcast platforms. Acres USA is North America's oldest publisher on production-scale organic and regenerative farming. For more than 50 years, our mission has been to help farmers, ranchers, and market gardeners grow food profitably, regeneratively, and with nature in mind. Find our books and other Acres USA media and learn about Acres USA events at acresusa.com. Read our online magazine at members.acresusa.com, and we'd like to thank Acres USA staff for their contributions to producing this podcast. This episode was edited and engineered by Weston Larson of Acres USA. We're grateful to our guests for taking the time to talk with us about their experiences.